All right. Okay. All right, I'm just going to wait another 2 minutes and we'll start. Okay. All right, so we're going to start. My name is Dr. Paul Stanislaw. I'm a facial plastic surgeon in Avon, Connecticut. I've been in practice for 22 years, and we used to do talks called Dessert with the Doctors. The Dessert with the Doctors were like a once-a-month event where I would give a seminar and talk about certain subjects. And since of COVID, so we're trying to do something different. So we're going to try this Facebook Live. This is the first Facebook Live that we've ever done. So bear with me because I'm trying to figure this out. The topic of today's talk is about events and planning for a big event. And a lot of times people have a wedding coming up or a reunion coming up or something where they really want to be as best they can be for that event. And oftentimes they wait to the last minute. So they try giving us a call, right like 2 months or 2 weeks before an event and say, well, I need this or I need that. And a lot of times there's not enough time to do what they want to have done. So what we're going to talk about tonight is just a timeline, trying to plan a timeline for a big event. And we're going to go through each intervention from injectables to surgery and how much time that you should allot. So the first place we're going to start is when you're booking a consult. So when you book a consult, you have to realize that anyone who's really busy and doing a lot of this type of work is going to be booked out for about 2 months. They're not going to be able to squeeze you in a week or the next day. So when you're planning to do something, realize that it's going to take at least 2 months to get in to see somebody just for the consult. So you have to take that into account. The other thing that you have to take into account, especially with weddings, is that before a wedding, everyone thinks, oh, that's the date, that's the big day. But before the wedding date, there are a ton of other things that happen before the big day. You're meeting people for the first time. You're going to showers. You're having a dress fitting or something like that. So all of those events interfere with procedures, being that, say you do a procedure where you do an injection and you might get bruised, and you don't want to be bruised when you go for that dress fitting. So you have to be really cognizant of all those other extra events that occur before the big day. So just be aware of that. Now, before we go any further, if you guys have any questions, I'm trying to read on the screen. If there's any questions, if there's a specific question, just write it and comment, and I'll try to answer the question as we go along. So again, if there's any questions, we'll just do this. It's much better when it's a dialogue than me just talking forever. So the first thing we're going to talk about is injections with like Botox or Dysport. So Botox or Dysport are injections that stop muscles from moving. So the most common areas we do are the forehead, we do the glabella, we do the crow's feet. So those are the most common areas. The Botox takes about 7 to 10 days to kick in. Dysport takes about 3 days to kick in, so it's pretty quick. But the thing that you have to realize is that when I see a patient who has like a big event, I won't do a Botox injection within a month of a wedding or a month of a big event. And the reason why is because there is always a risk with Botox or Dysport in that if you accidentally inject Botox or Dysport into a blood vessel, it can affect another muscle that you don't want to affect. So if you're doing the glabella area, it can drop your eyelid. It can make your lid heavy. If you do your forehead and you're very sensitive to it, it can make your brow heavy. If you do your smile lines, there's always a chance that it could affect your smile. Now, those events are very, very, very rare. For example, like for me injecting here and affecting someone's smile, in 22 years, it's happened 3 times. For here, which I do this injection many, many times a day, in 22 years, I've had 9 cases where I drop an eyelid, or the eyelid looks a little heavy. Now, in all of those instances, when something like that happens, they only last 3.5 weeks. So if I drop someone's eyelid, make their eyelid heavy, it only lasts for 3.5 weeks and it resolves. If I was to inject here and it changed someone's smile, it would only last 3.5 weeks. So whenever there's a big event, I won't inject any Botox or Dysport at all within a month of that event. So I could probably get away with it, it'd probably be fine, but I will not do it just because if there's one chance out of 1,000 or 1,000,000 that that's going to happen, guess what? It's going to happen right before your wedding. The other thing that can happen with Botox or Dysport is when you inject, you could have a bruise. Now, most bruises resolve within 10 days, maybe 2 weeks, but it is possible that you could have a bruise for a month, right? Not a big bruise, but it could be there for a month. I have seen it where someone has a little tiny bruise somewhere around their eye or here, and it just doesn't go away, and you have to put makeup on top of it. So once again, if you're thinking about having Botox or Dysport, you want to do that before a month, before a big event. Now, Botox and Dysport doesn't last forever. So you have to realize that you have that window where you can do that. And so you'd want to do that probably between around 3 months. So you want to do it about 3 months before, not much further, right? You don't want to do it 5 months or 6 months because by the time the wedding comes around, sometimes it'll be wearing off. So figure about 3 months before the wedding. And the question that I've got was that can the reaction be reversed? So if I was to make someone's eyelid heavy or change their smile with an injection here or make them heavy here, there's nothing to reverse that. It just takes time. The nerve has to make new receptors and there's nothing that you can do to speed that process up. So it's not like you can turn that off. The good news is it always goes away. It never is ever is permanent. How soon after injection can I apply makeup? So you can apply makeup really pretty much right after, like that day after the injection, you can put makeup on. So that's not an issue. And if you have a bruise, you can put makeup on that too, of course. But usually, when you do the injection, you'll be a little red, a little swollen for maybe 20 minutes, 30 minutes, and that's about it. And then it all settles and goes away. So again, for Botox or Dysport, they're both used for here, or here to stop the muscles and to make the wrinkles better. But what you have to remember is you don't want to do it within a month of the event, and you want to do it probably around 3 months, 2 to 3 months right before the big event, so that it's fully kicked in and you've got what you know what you've got. The other thing that I suggest is that you don't want to do something for the first time right before the wedding. Like if you've never had your glabella done, if you've never had your forehead done, you've never had your crow's feet done, you don't want to experiment right before a big day, even a month out or 2 months out or 3 months out. So if you've never ever had it done and you've thinking about doing it, you want to do it, experiment like a year in advance. Try it, see how you like it. If you like it and you think it's a great thing and it's all good, then you would do it right before the wedding or the big event. But you don't want to experiment. Oh, I've never had my brows done, my forehead done or anything like that. I want to just do it right before the wedding. That's really not a good idea. You want to make sure you like it and you know what you're getting into way in advance. Again, the question is how long does the bruise last? Everyone's different. Most people don't bruise, but you can definitely bruise. And that bruise can last anywhere from 7 days to 2 weeks. But again, it's a bell curve. You can have an outlier where someone's still at a bruise in a month. So again, you don't want to take that chance. You don't want to be worrying about it for a big event. The next thing is fillers. Now, fillers, even though it is an injection, it's a completely different type of injection. With fillers, you're trying to spackle out a wrinkle. So smile lines, these are called marionette lines. We do tear troughs, so the hollows under people's eyes and sometimes the cheeks. And then sometimes we'll do like very fine lines like around the mouth or in the glabella area once they've become embedded, once they're there at rest. So in that situation, you're injecting it right into the skin or below the skin. Again, there's always a risk of bruising with an injection, and specifically with fillers. Fillers get a little complicated because it just depends on the area that you're doing. So we're going to start by area with filler. So if you're going to do injection for smile lines or marionette lines for that matter, those injections are done underneath of the skin. Yes, it can bruise. Here bruises maybe about 20% of the time. Here it's about 5% of the time, so it's really not that common for up there. Again, the bruise is usually about a week to 2 weeks. The thing about this area is that the skin is very thick and through here, so lumps and bumps are very, very rare. Yes, it can get a little bit swollen right after the injection, but that type of swelling only lasts a couple days. So with doing fillers for here and here, once again, I would say you'd want to do it a month before, not really any closer, because if you do bruise, it might become an issue, so you don't want to have to worry about that. So fillers in these locations last about 9 to 12 months here, 12 to 18 months here. So anytime that year before the event, you can have filler done. So again, you don't want to experiment right beforehand, like really, really quickly, like within the month or whatever. You want to, if you've never had it done, you want to do it a year in advance, 9 months in advance. Try it, see how you like it. If you like it, great. It's going to last a good long time. You're going to be pretty good. If you don't like it, the fillers you can erase, right? So if you ever said, oh, this does not look good, I don't like it, I have a lump or a bump that I can't get rid of, well, then you can inject an enzyme into that and dissolve it. So another injection, and you can make that all go away. Does weight loss or gain change the look of fillers? It doesn't change so the question is, does weight loss or gain change the look of these fillers? It doesn't change the filler, but let's take the cheeks, for example. So say you're slightly overweight, and I put filler into the cheek because there's a little hollow there. And then you go on a diet and you lose 20 pounds. Well, this is going to deflate. This is going to get hollower as you lose that weight, obviously. And so you're going to be like, oh, that filler didn't last. Oh, why? Like, I did this filler and now I'm losing weight. Now, look, it's getting hollow again. It's just you're losing the fat and you might need more filler. For pretty much everything surgical, and for everything surgical and for some things fillers, it's really best to be your ideal body weight when you do it, okay? It's very true for all the surgeries, facelifts, brow lifts, those type of things. You want to be your ideal body weight when you do it. But fillers, when you're filling a depression, you're not trying to give someone big cheeks, fat cheeks. You're just trying to spackle out the hollows. You're trying to fill the shadows. If you do it and then lose weight, it's gonna get hollow again. If you put on weight, it's really not gonna matter too much because the weight's just gonna go around it, so that doesn't really matter with the weight gain. So again, for doing something like this, you might bruise. You don't want to do it within a month of the event. You always want to do this more like months in advance because they do last 9 to 12 months. And you want to make sure that you like it. Now, for areas like the cheeks, when we do that, again, the skin is thick, and we can put that in there. You might bruise again, but for this area through here, sometimes people have just a little hollow or a little malar crease. Some people are very, very hollow. And sometimes as you fill this area, if you're doing larger volumes, you need to sometimes put more in. You might do it, it might be swollen, you might come back in 2 weeks, you might look at you and say, you know what, it's still a little swollen, we gotta put a little bit more in. So sometimes it's not just a one and done. It's not like, I'm doing it and I don't have to come back. Usually when we do these type of things, we will do it. We'll have people come back at 2 weeks. At 2 weeks, we might have to mold, we might have to shape it. We might actually put more in. So sometimes it takes maybe another visit or two to get it completely as perfect as we can. So you want to give enough time for that type of finesse work to really tweak it to get it as good as we can. So again, you're going to want to try to do these things as early as you can within that year before the event. Under the eyes, so this is tear troughs. Now that's probably the most common thing that I do. So when people have hollows under here that make them look tired, make the bags look bigger, and they have hollows, this skin up here is very, very thin. When that skin is very, very thin, it can swell very easily, it can bruise very easily, and you have to be very, very delicate with that to make it as smooth as you can. And that often takes some finessing. So we might do that. It might take about an hour and a half to do that procedure. You're going to keep your head a bit elevated for the week, no bending with your restraining for the week. So you do have there's a chance of bruising for that week. So you don't want to plan it where you have, a dress fitting or something going on that weekend. Then you'd come back in 2 weeks and it might mold, I might shape, I might put more in. Again, it is a finesse thing. Sometimes it takes a couple of visits to get it as ideally as we can and to make it look as good as we can. So you want to have enough time to work on that and to really tailor it to the person. But for fillers under the eyes, that, unfortunately, I see a lot of people who get filler under their eyes and it doesn't go well. And, they think they're getting tuned up for their wedding and they're like, I'm going to get this filler, get this done. And they go someplace and it looks horrible. There's lumps, it's bumps, it's just distorting, and they're really unhappy. And then they call me up like 2 weeks, a week before the wedding, and they want me to fix all of that. That's really hard to do in a very short period of time. So be very careful of that. So if someone comes to me and they've already had filler and it looks bad and I have to correct it, this is how this goes. The first visit, I have to evaluate it, see which filler they've had, try to get an idea where it was, try to get an idea how much filler was put in and what type, and then I'll enzyme it. So I'll inject the medicine in it and I'll dissolve it. That enzyme, it sometimes takes a couple times to get it all out, to make it dissolve all out. So I would enzyme someone in the areas, see them a week later, see if I got all of the filler out. If I haven't, I might have to inject the enzyme again and try to dissolve it again, and then see them back another week. So it might take 2 weeks to get rid of the stuff that was there or that was already placed, because I don't know exactly where it is. I don't know what level it's in. I don't know how much is there. So the removal of the bad stuff, of the stuff that's no good, can usually take about 2 weeks. Now realize that every time I inject that enzyme into that, there's a chance that I bruise you. And when I'm injecting this enzyme, it can bruise a lot, unfortunately. The enzyme, the medicine that dissolves the fillers, can allow bruises to spread. So what should be a little tiny bruise can be a bigger bruise than you expect. So you have to plan that. Also, the skin gets a little swollen, gets a little red. Um, then after 2 weeks, once we get it all removed, then I've got to figure out, well, how I'm going to fix it. Now I have to let the enzyme do its thing for about a week. Because if I try to do it, I can't put the filler in right after I put the enzyme in. I have to let the enzyme chew everything up, remove everything, let it all settle down, and then I can go back and I can put filler in. So now, the wedding's coming up. It's really, really close. And now I have to get all of this filler, get all this finesse work, and get this all done before the wedding. And that is very stressful because, again, it takes time. Sometimes it takes time to finesse it and to make it look good. And there's not enough time to correct things. So you don't ever want to get in that situation, because that is very, very stressful when someone, they do it right beforehand and I don't have enough time to fix things. Can I use makeup? Can I use makeup after the enzyme injection? You can. So again, whenever I do an injection with fillers, not with like Botox and Dysport, you can do it that day, but with fillers, you can't put makeup on for 24 hours. So after I do a filler injection, you're going to put some bacitracin and neosporin ointment on the sites that I injected through for the day, and then the next day, if you have a bruise or if it's red, or you can put a little bit of makeup on at that point. So 24 hours after the injection, that's true for fillers and it's true for the enzyme. So with fillers under the eyes, you really, really want to do this many, many months in advance. Many months. So a year, 6 months. Within 6 months, 3 months gives me agita. I do not want to start doing tear troughs for somebody 3 months before a wedding or a big event. So 6 months, really the latest. A year is even better. You want to make sure that everything's good, that you like it, that it's all good. Filler under the eyes lasts for many, many years. So it's not like you're going to do it at a year and you're going to have to touch it up in a month or 2 months or 3 months. That filler is going to be under your eyes for years. Same filler that you put down here, here. When you put it up here, it lasts a lot longer because there's nothing banging on it. There's no motion there. Down here, there's a lot of mechanical motion. It chews up quicker. It goes away quicker. Next question. How long does the filler under the eyes last? So I just said. So I have many, many patients, the filler is under there for 10 years. Okay, so 10 years, filler was here and it's still there 10 years later. That's not uncommon. That's really, I see that a lot because I've been doing fillers under the eyes for probably 16, 17 years now. I think the fillers came out around 2005. But it lasts for many, many years. Now that sounds like a really good thing. However, when the filler is under the eyes, over the next 10 years, your face is going to change. So what I tell people is when you do filler under the eyes, you're taking on a commitment of maintaining it, of molding it, shaping it, putting a little bit more in, maybe taking a little bit out. There's a question about how long do I need to wait to fly? So for fillers under the eyes, this is eyes specifically, when you do the tear troughs, you can't fly for a whole month, okay? Fillers that we put here are hyaluronic acids. It's a fancy term for just a bunch of sugar molecules that are all stuck together, and the filler acts like a sponge. It holds onto water. And so when you put it in areas like the smile lines and the marionette lines or the cheeks, where the skin is very, very thick, then flying doesn't matter. The fat that's here, the thick skin, it can tamponade, it can suppress the fluid, it won't let it swell. But when you do under the eyes and you do the tear troughs where the skin is very thin, you can't fly for a whole month, okay? Because I have had people where I've done filler under their eyes, they jet off to Florida, they get on the plane, everything's fine, but because of the barometric pressure changes as the plane goes up into the air and they come down and land, when they get off the plane, their eyes are all puffy. So you don't want to ruin your vacation doing that. So you don't want to fly for a month after we do the injection under the eyes. So just in recap for fillers, before we do the recap, the other application of fillers is when you do like little fine lines. So a lot of women and men will develop lines in their upper white lip. that are very superficial. They're not very deep. People call them smokers lines, even though they just happen to everybody, not just smokers. For that, what I do is I inject filler into each individual line with a very, very fine needle in the skin. The downtime with that is that it could look welty for a couple days, and it can look like a red scratch for a couple weeks, like 2 weeks. So you might have to throw makeup on that. So when you do those little lines, you'd want to, again, you don't want to do it within a month, but you can do it probably like 2 months, 3 months beforehand. That's like the soonest. When you do these lines, that again lasts for a year. So anytime in that year, if you're interested in doing that from a year to 3 months, you can do filler to those lines there. But plan on looking like you got some red scratches there for 2 weeks. You're gonna have to throw makeup on top of that, or wear a mask in COVID days. And it'll look little welty, little ridges for about 5 days for that. So in recap for fillers, it depends on the area that you have done. Again, you don't want to experiment right before a big event because you want, if something was to go wrong, you want to have time to erase it and you want to have time to do it the right way. But that takes time to get in to see people to do that. So for this area and this area, about 9 to 12 months it lasts, so you could do it within that year, but again, you don't want to do it within a month. For this area, year, 18 months, it does pretty good up here. Again, you don't want to do that within a month of a big event because you want to make sure that it's all nice and smooth and everything. For the tear troughs, for up here, I wouldn't do it. The last I would do it would be 3 months in advance. I would do it preferably 6 months in advance. I wouldn't want to do it any sooner than that. But sometimes I'm forced to, especially when I have to correct other people's work. Sometimes I'm forced and I'm doing it 2 weeks beforehand, but that's really kind of nerve-wracking to do. So that's fillers. For resurfacing procedures, okay. All right. Actually, before we get to resurfacing procedures, let's talk about skincare. So a lot of times we talk to patients about things that they can do to slow down the aging process. Nothing's going to prevent you from aging. There's no anti-aging anything. It's all just to make you hold on to your elasticity as long as you can. So sunblock, super important, right? That's the most cost-effective thing you can do to slow down the aging process. Retin-A's, topical vitamin C's, topical vitamin E's. So all of those things are very good to slow down, to maintain your elasticity, to slow down the aging process. But you don't want to start those right before a big event, right? They're not miracle drugs. It's not like you're going to put that cream on and all these lines are going to go away right before the wedding. They're something that slows down the process. It's not really going to make everything go away. And you run the risk of having reactions to them. So Retin-A makes your skin red, flaky, and sensitive. That's what it does. And you have to be really educated on how to use that correctly. You're not going to start that right before a wedding. You're not going to start that a month before a wedding. There's no point in doing it. Why take the chance? I often have patients come to me and ask, well, I want to do my microdermabrasion, like I'm getting married next week, or I want to do a chemical peel with the esthetician, or I want to do an enzyme peel or something like that. You don't want to do those within a month of that big event. You don't want to start anything new. You don't want to do anything like that. Because if you have an allergic reaction to any of those medications or any of those things, skin allergic reactions take weeks to resolve. It's not a quick, oh, I stopped it, I washed my face and the rash goes away. You could be red for weeks and you could have lumps and bumps and just irritation from that. So you do not want to start any new creams, any new makeups or anything like that within that month of that event, because I have seen that too. I've seen people where, you know, they go and they have this done and they start this thing and they have an allergic reaction and they just want it to go away, and that wedding's coming up and it's just, I can't do it. So once again, over that year before that a big event, you want to practice with that medicine. You want to practice with that makeup. You want to get your makeup matched well in advance. You don't want to be messing with that at the last minute for that. Can I use the same? All right, so the question is, can I use the same products year round? Depends on where you live, and it depends on how good you are. So if you live in New England and you're really good about your sunblock and you're not going out in the sun, it's not like you've got little kids in soccer games all day long. I think you can do Retin-A all year round. You can do your vitamin C and E all year round. You can do all those things all year round. But if you're going to be out in the sun, out on a boat all day long, or doing stuff, even with sunblock, you're going to want to stop your Retin-A. You can do the C and E throughout the year, but you're going to want to stop the Retin-A over the summer. Also, oftentimes when we use bleaching agents like hydroquinones or non-hydroquinones, we try to stop the hydroquinones during the summer and switch to non-hydroquinones during the summer and use the hydroquinone bleaching agents during the fall and the winter. All right, can you feel, all right, I need my glasses, hang on. Can you feel 11s with filler, Botox, or origami? Yes, you can. So the question is, can you fill the 11s, those are these wrinkles up here with filler because Botox isn't working there? So there are two issues that occur here, and what happens is there's what I call dynamic wrinkles. So at rest, there's nothing embedded, there's no wrinkles there, but when you scrunch, the wrinkles become embedded. Botox only works on those, so it only stops the muscle from contracting. It doesn't do anything else, it just stops the muscle from contracting. Over time, when the wrinkles become embedded, so they're there at rest whether you contract or not, Botox doesn't fix those. It will not fix an embedded crease. So once they've become embedded, then you have to inject filler in there like spackle. So if someone has only the dynamic part, all right, they're perfectly smooth when they're not scrunching, but when they scrunch, they get the frown lines. That's Botox. When they have embedded wrinkles, so they're not scrunching, they're there at rest, we often end up doing both. We end up doing both Botox to stop the muscles from contracting and filler into the lines to stop the line, to spackle out the lines. Now, again, when you're doing filler here, it can look like a red scratch for 2 weeks. You might have to put makeup on it. It can feel firm for a couple weeks. That's normal. I tell people don't worry about that. That'll always go away. No one's going to come up and feel your glabella. But yeah, it can feel like a little firmness through here, and you might have to put makeup on it for 2 weeks. But yeah, if Botox is not making Botox really won't make embedded wrinkles go away, so you're going to have to do filler. Does your esthetician do makeup for events? Yes, she does. Once again, you'd want to schedule a consult in advance of the event, meet with her, and work with her, get the education, and come up with a game plan. It's not recommended that, like next week is the wedding and I got it. Like, it can happen for sure, but it's better to not rush those things and sort of plan those events and try to do that before an event. What else are we talking about? So, again, with skincare for big events, you don't want to start experimenting right before a big event. It's not like, I want to go have a microdermabrasion right before the big event, because there's always a risk of a skin irritation or a reaction to something, and if it happens, it lasts a lot longer than you think. Chemical peels. So when people have deeper wrinkles, like they have brown spots all over, they have wrinkles all over, and it's more global, you can't just fill every little line, or the wrinkles are so fine that you can't really fill them, they're just too small to fill, and we want to fix the texture of them, we'll do a skin resurfacing procedure. So for that's either a physician strength chemical peel or a laser resurfacing. The thing with the chemical peel and the laser resurfacing is that we don't do them during the summer months. We only do them from October through April. After that, we stop doing that. The reason being is because you can't wear sunblock, and if you get sun to the area, it can cause hyperpigmentation, and you'll be brown and blotchy, and it'll take a couple months for the brown and blotchies to go away. So we don't do that during the summer months. So there's 2 questions here. What services do you offer that do not have to be to be done months in advance, tanning or facials. So the one thing that you want to do in like right before the event is spray tanning. So if someone, well, tanning isn't good. So no one wants to tan. So tanning, I know people like to tan, but wrinkles, pigmentation, skin cancers, if you're going to tan, it's going to overpower everything we do. So you don't want to tan. But oftentimes before people go on vacations, before big events, people will do spray tanning. So spray tan you want to do like right that week right beforehand, because if you do it wait too early, it starts to wear off. So you want to do it within the week before a big event. Again, I would practice with that way in advance. I'd find someone that you really like that does a really good job, that does a lot of it, and just do a trial run and see how you like it before just going in cold right before a big event. All right, please advise what type of CO2 laser you use. All right, CO2 lasers. So I do not, so years and years and years ago, I used to do CO2 lasers. So CO2 lasers came out in the early 1990s. They were the hottest thing. Like we did so much CO2 lasers in the 90s. They were very, very strong. They had a very long downtime. So when you did a CO2 laser of someone's face or on their eyes and stuff like that, it would be about 2 weeks of Vaseline, 2 weeks of cleaning, swollen, and you ended up going to the having anesthesia because it was actually very painful to have done. What we found though was that it was a little bit too deep and too aggressive. Well, at least my personal opinion was too deep and too aggressive, in that and those people that had the CO2 lasers, if you follow them out long enough, not at a year, maybe not at 2 years, but if you looked at them 5 years, 6 years, 8 years, 10 years out, the areas that you resurfaced, about 20-25% of people, that area turned white. So like even if you're white as a ghost, you even became whiter. And that once that white happens, it's never going away, you're done. So that 20-25% was it's too high for me. And also the CO2 laser, the fully ablative CO2 laser, that means it's removing everything, was just the downtime is too long. People can't give you 2 weeks anymore. It's just not reasonable. So there are non-ablative CO2 or semi-ablative CO2 lasers. Those are like the Fraxels. Those are the ones that sort of punch the holes into the skin. So it's not removing the top layer of skin where it's just drilling down. I personally am not a big fan of those. I don't think they're very cost effective. They also are painful. They also have downtimes. They also have risks. And I don't think that they really live up to what the expectations are for those. In my practice, I'll do erbium YAG lasers. So that's like a CO2, but sort of middle of the road. Not as strong, still fully ablative. Downtime's about 10 days of Vaseline, not the 2 weeks. So it's 7 to 10 days. It's a shorter downtime. So I don't see the hypopigmentation years out with that. So I don't have to worry about that. And I also do chemical peels. I like chemical peels a lot. I know everyone likes lasers. Lasers, the technology, it's a great thing. But chemical peels, physician strength chemical peels, are the same medium depth, same as the erbium YAG laser. Downtime's a little bit easier, and it's very elegant, and it does a really nice job. So I tend to do either a medium depth chemical peel or a erbium YAG laser resurfacing. But for all of those things, for those resurfacing procedures, you want to do that many months in advance. When you do, even if you did a CO2 or an erbium YAG or a chemical peel, yes, right afterwards, you're 7 to 10 days of Vaseline. Then you've got about 3 weeks where you have to baby that skin. It's Cetaphil lotion, Cetaphil moisturizer, no makeup except Jane Iredale makeup that's made specifically for resurfaced skin, no sunblock, nothing, because it's very sensitive. It's baby sensitive, and it could get irritated. After a month, you can then start resuming your Retin-A, your makeup, your sunblock, and all that type of stuff. So because of that period where you can't wear sunblock and you have to protect it from the sun, that's why we only do that during the winter months. But the final end product, so right afterwards you're swollen, but the final end product, the improvement in the lines, the improvement in the wrinkles and that type of stuff, that can take up to 3 months to see that, for the skin to mature and for all those fine lines to improve. So you want to have enough time for those type of changes to occur. Yes, a lot occurs in the first couple weeks, but the final end product for resurfacing is about 3 months out. You have to repeat, all right, so the question is, you have to repeat the peels after a period of time. Depends on how deep the wrinkles are. It's a very good question. So say someone has really, really deep wrinkles or under their eyes, just take that for example. You can't just go like gangbusters. You can't go super, super, super hard because they've got deep wrinkles, because if you go too hard, you're gonna scar them, okay? So sometimes when people have really deep wrinkles, I'll say, listen, this is degrees of improvement. It's not gonna make this all go away. We're gonna do this time as hard as your skin will tolerate, because everybody's skin is different. Some people I can go harder, some people I have to go gentler, but your skin's gonna tell me how hard I can go, and that's it. Now, that might not make all the wrinkles go away, and we might have to stack this. So a year later, and I usually choose a year. I'll let a year go by, and then I might do it again under the eyes, or to try to get a little bit of improvement, more improvement, because you just can't crank it up. And once you have a white scar, once that skin is white, there's no fixing that. So yes, you can repeat those things, but usually we'll repeat them like a year later, and it's usually for people who have got really, really deeper wrinkles. So again, for an event, you want to, if you're going to do any type of resurfacing procedure or anything like that, you're going to do that within like a year out, because you want to be all done with that and not have to worry about that, and you want to plan that into winter months, not any sooner. And that's true for lasers. Also for like blood vessels. So a lot of times people have like capillaries and blood vessels. They don't want to wear makeup to the wedding, or they don't want to wear makeup to the event. They want to cover up the blood vessels, because you can always wear makeup over blood vessels. But sometimes we do have to repeat those lasers for blood vessels. So I might treat someone once, see them back a month later, and I might have to treat them again, and I see them back a month later. Same is true for brown spots. So it's not, everyone's skin is different. I can only go as hard as your skin will allow, and you can't just crank it up and go. So sometimes it takes a couple treatments, so you have to plan enough time. It might take me 3 tries or 2 tries to make the blood vessels go away with that. Tattoos and laser removal, that's a whole nother animal. If someone has a tattoo and they want to get rid of it before a big event, sometimes you can't make it always go away. Sometimes it's degrees of improvement, you're just lightening it, but it takes many, many months and many, many treatments to make tattoos go away. When you do a laser treatment for a tattoo, the laser is actually just breaking up the dye, and your immune system has to come in and pick up those broken particles and get rid of them and take them away. And that takes time. So I might do a laser on a tattoo, see them back at a month, and it looks better. See them back 6 months later, and it's a lot better, because time has happened to remove the particles from the tattoo. So tattoos are, if you're thinking about having a tattoo removed before a big event, you're looking at over a year. You have to start that 2 years in advance to get that to go. Do you do all of your own injections in your practice? Yes, I do all of the Botox injections and the Dysport injections, and I do all the filler injections. So all of those things I do myself. I like doing them. I really think of facial rejuvenation as being holistic. Like, it's not just surgery. I try to pick the right tools for the right components. So sometimes you have to do a combination of things. You have to do surgery and a filler, or a filler and Botox or Dysport. And I just feel like you have to have a plan. And I like having all those tools at my disposal to do a good job. It's not like you can pull everything out or you can fill everything. When people look really, really weird, it's because someone's tried to do it all with one modality. Oh, I'm going to pull every wrinkle out. Oh, I'm going to fill every wrinkle and make it all go away. And then they look like all big bloated chipmunks. So I do all the injections and I do all the surgery myself. Which brings us to surgery. So the most common surgery that we do is facelifts. So facelifts and neck lifts. Those are usually the parents of the people getting married. Sometimes it is a person getting married. But they'll come in and they'll have concerns about their marionette lines. They'll have jowls. They don't like their neck. And they want to have this done before the reunion or before they're meeting someone. So when we're doing facelifts, you're going to, again, want to do that 6 months in advance or earlier, okay? You could do it sooner, but sometimes, like, the incisions, like when you do the incision, sometimes it can be pink for a couple months, right? Like, everyone heals differently, and you can always throw makeup on top of it, but you want everything settled down. You don't want to have to worry about it. You just want it all done. So the ideal time for a facelift, neck lift would be about 6 months or earlier for an event. So year to 6 months. You don't want to do it any sooner. The facelift that I do is what's called a deep plane facelift. It's just a fancy term for freeing up the anchors that are underneath of the tissue and allowing it all to move smoothly and redrape nicely. It's more powerful, lasts longer, looks much, much more natural. And that I can do in the office or under and that's under local anesthetic, or I could do it at the hospital with you asleep. Do you do these procedures in the hospital or are you in the office? All right, so, okay. So for some procedures, you need to be asleep, and some procedures you don't have to be asleep, and it really depends on the person. 98% of the facelifts, neck lifts that I do are in the office under local anesthetic. There is a huge, huge trend of cosmetic patients not wanting to have anesthesia. Everyone hates anesthesia. It makes them scared. They don't want to go to the hospital. They're afraid of getting infection. They're afraid of getting COVID. They don't like how anesthesia makes them feel. Most of my patients, by the time I do a facelift on them, they've already had an injection. They've already had filler. They've already had Botox or Dysport. So I'm like, all right, I'm going to inject numbing medication here, and I'm going to inject numbing medication here. It's going to last you for about 8 hours, just a needle. Everyone's like, you know what? I've had needles before. No big deal. Let's do it. I have patients who hate needles. They don't like needles at all. The thought of a facelift makes them want to vomit. And they're going to be squirrely. For those patients, I just take them to the hospital. It's outpatients, but they're under anesthesia. So they're under general anesthesia. They're asleep for the entire thing. You go to sleep, you wake up, you go home that day. It's the same procedure, same outcome, same duration of surgery, same amount of local. It's just when you're awake and when you're asleep. People will always ask me, well, is there a price? There's got to be a price difference if I do it here. Yes, it's less expensive to do in the office because there's no OR and anesthesia fees. However, what I tell people is you can't make the decision based on price, okay? If you're going to be squirrely, I can't spend the whole time talking you off the ceiling, so it's better for you to be asleep. And why have a miserable experience? So you can't do it on fees. Next question is, how long does a facelift last? Depends on the person, okay? What determines how long a facelift lasts is how someone holds onto the fat and bone of their face. As we age, we lose fat in our face, we lose bone mass in our face. If I showed you a skull of a 20-year-old and a skull of a 60-year-old, you'd be able to tell the difference between the two of them. A 20-year-old's got more bone mass in the cheeks, a lot more bone mass in the jaw. Eye sockets of a 20-year-old, little round sockets of a 60-year-old, the eye sockets are more egg-shaped, they're more ovoid. So the facial skeleton dissolves, it resorbs, it shrinks front to back, up and down, side to side, just like osteoporosis. So as the aging process goes on, and people age differently, this volume is gonna deflate. And the way I sort of explain this is, say I do a facelift on someone today and I pull them as tight as I can around a given volume. I do everything I can. And then after the facelift, they go on a diet and they lose 30 pounds, 40 pounds. They're going to come back in 6 months and say, that facelift did not last, right? I'm all saggy again. Well, it's because I pulled it as tight as I can around a volume and then you deflated it. As we age, aging is not linear. When we're 30 and 40, it's kind of linear. It just sort of trucks along. And then as we get to be 60 and 70, that aging process becomes logarithmic. It starts to speed up. So what I tell people is what determines how long a facelift lasts is how long you hold on to your fat and your bone of your face. And I have no control over that. I usually tell people really vague 7 to 10 years. I tell people that 75% of people who come back for a touch-up facelift, oh, I'm here for my touch-up, I had it with you 7 years ago, 10 years ago, 75% of them, it's a filler event. They've become hollow in certain places, like it's a liquid facelift, so we'll inject filler into those to just spackle out the hollows. The other 25%, everything's sagged enough, everything's sort of droopy enough that they would benefit from having another facelift. All right, so can you place fillers after a facelift? So you can place fillers. Ideally, you do the fillers after the facelift because that way you can use much less fillers. My goal is always use as little filler as I can because you have to take care of it. You have to maintain it. It gets expensive very, very quickly. So if I do a facelift first and then I see the patient 3 months out, right, and they might still have a depression here or a depression up here, which a facelift doesn't fix hollows. You can't pull out a hollow, okay? A facelift repositions against gravity, so when the jowls sag, you move it back up here. It makes the skin container smaller because you're trimming out the extra skin. You're cutting out links out of a stretched out slinky. All right, you're not making a good slinky. You're not making the skin elastic again. You're making it a smaller slinky. And it pulls things flat. So if your jawline's got all sorts of saggies, it pulls things up. A facelift doesn't make you elastic, and it doesn't make curvatures. It doesn't fill hollows. So sometimes you'll do a facelift and you lift this up and person will still have a hollow there. And at 3 months, they might say, you know what? It's good. I'm much happy. It's great. I don't need it. Or they might say, you know what? It's good, but I still see this little hollow. Well, then we'll put filler in at that point, but you can use a lot less filler. So it's always better to do the filler later. But having filler done before doesn't stop you from having a facelift later. You can always do a facelift after having filler. But again, so from a facelift standpoint, in regards to a wedding, you want to do that between 1 year and 6 months. So what happens is with a facelift, you do the consult first. So figure it's going to take 2 months to see a doctor to do the consult. Then you're going to book that date where it doesn't interfere with any other events. You're going to have to do a pre-op with your primary. All right, so you have to get an EKG and lab work. That's a month before the procedure. You're going to see the doctor for the pre-op visit, so that's 2 weeks before the surgery. So at that visit, you go over your pre-op with your primary. So the doctor goes over your EKG and your lab work and all that type of stuff. Have you sign your consents, take your photographs, gives you your pre-op instructions, gives you all your supplies that you're going to need, and answers all your questions. Then you do the surgery. Then, like in my practice, we see you the first day, the second day, the 7th day after the surgery, the 10th day after the surgery, 1 month and 3 months, okay? At the 3-month visit is when, all right, we might do filler here, or we might do a peel, or we might do something adjuvant to the facelift to make things look better. But we usually address that at 3 months. So again, if you're doing this for an event and you do it at 6 months, I'm going to just be finishing up about 3 months right before the event, right? So you need to have enough time, and you can't come and say, well, I've got a party this weekend or I've got a big board meeting and I can't do it. Then, I'm not going to take a chance to bruise you or something that's going to happen. So you have to plan that a little bit better. Other surgeries that we do. So lower eyelid bleph. So when people have bulges there. Again, you'd probably want to do that about 3 months in advance. You don't want to do it any sooner. The recovery for that's pretty short though. A little bruised, a little swollen for about a week, 10 days. And that's about it. So that's that's probably the shortest, because for that surgery, for the bulges, you're asleep for it. So that is at the hospital. You have to have that done at the hospital. What I do is I roll your lower eyelid down and make a little cut on the inside of the eyelid, and I take the fat out. So there's no cuts on the outside. There's no stitches on the inside. Bruises just a little tiny bit, a little swollen, but that's it. But sometimes when the people have bulges, people will still have wrinkly skin, or they might have tear troughs or hollows. So I might do the surgery first, then the next day do the chemical peel to help with the wrinkles, right? That's got the longer downtime because that makes you swollen, the Vaseline and all that stuff for the week. So the chemical peel is a longer downtime, but that's to address the lines. We let all that settle down. And then at 3 months, if someone has a tear trough, right? So taking the bulge out doesn't fill a hollow. And people have to realize that under the eyes, it's multiple components. It's the skin wrinkles. It's the dynamic wrinkles from smiling. It's the hollows. It's the bulge. Each component is treated differently. So you have to have time after. So if I do the bulge, the next day I do the chemical peel. 2 to 3 months later, I do the filler under the eye for the tear trough. So I have to have enough time to do all of those things before a big event. So again, a consultation super early, like a year out, is going to be really important, because that way you can discuss all the different components. You can be educated. Well, all right, what do I have? What is the treatment for that part? What is the timeline? How can I plan this? So even though the lower eyelid surgery is fast, there might be other things that are also adding to the appearance, because it's a gestalt. It's not just one thing. It's how all these things come together that make up under your eye, and all of those might have different treatment options. For the upper eyelid skin, okay, so that procedure, when there's a lot of extra eyelid skin, we do that right in the office, almost universally. Basically, it's for the upper eyelid skin. What's going on is when you're young, the eyelid skin's like a rubber band, right? You close your eyes, it stretches. You open your eyes, it contracts like a rubber band. It maintains its shape. And as you get older, when you open your eyes, it doesn't contract anymore because it's inelastic, and it rolls up like a Roman shade. It folds up on itself. There's nothing I can do to make it into a rubber band again. I can't make you elastic. So all I can do is have you close your eyes, measure how much extra eyelid skin that there is with your eyes closed, and that's all I can take out. Okay, so basically with your eyes closed, I measure how much there is extra, take that out so you can still close your eyes. What does it translate to? Well, when you open your eyes, you're still going to have a little bit of a fold there. If I measure it with your eyes open and take the entire fold out with your eyes open, you're not going to be able to close your eyes because your skin doesn't stretch anymore. Okay, so this is always degrees of improvement. But that procedure is done in the office with just local. Again, we usually do, you don't have to do a pre-op with your primary or anything like that, but we usually meet with someone like 2 weeks before the procedure, give them prescriptions, take their photographs, have them sign a consent, so they're all set, so there's no messing around the day of the procedure. They come and they do the procedure, they go home. It takes about an hour and a half, 2 hours to do. It's not too long. You go home, you have stitches that are in for a week. Gonna have to put a little Vaseline on that. You're gonna bruise, all right? So down here, bruises not so much. Here, no matter how meticulous I am, it still can bruise. How much downtime is needed for a facelift? Needed after a facelift. Okay, so it depends on what you consider downtime. So first thing, bruising. People will bruise here, and people will bruise here, and sometimes people will bruise here. Some people bruise a little, some people don't bruise at all, some people can bruise a lot, some people the bruise goes away quick, and sometimes the bruise can take a month to go away. Like up here, I've seen it where it's a little bit of a bruise. But you can't throw makeup on top of it. So figure about 2 weeks for the bruises to settle down. Then the next component with what's the downtime? It's going to be a little lumpy and bumpy right around here. So right through here, there's going to be little lumps and bumps. that always settles down. It always goes away, but it can take 4 to 6 weeks for that to settle down. So if you've got really short hair, so if you're a guy, I tell people, yeah, it's gonna take about a month to settle down before you go out, before anyone's gonna know. If you're a woman and you can pull your hair down, 2 weeks, you can pull your hair down, you can cover it up, put makeup on, you're going out. So for a woman, it's about 2 weeks downtime. For a guy, it's about a month if they have short hair. The other thing is when you do surgery for these areas, right? These areas can be numb. They're not can be numb, they're gonna be numb. After I do this, there's no way for me to do surgery without making this numb. So it takes about 6 months for the numbness to go away. It'll go away, but it can take a while for that to go away. And then the last thing is the incision. So sometimes with these incisions, sometimes you take the stitches out, you can't even tell you were there. Sometimes you do a procedure on a person, the incisions, and 3 months they're still pink and they have to put makeup on and throw the hair down. So it really depends on what your definition is of what's your downtime. If it's, I just need to go out, go to the store, go to work, pull your hair down, it's 2 weeks if you've got hair long enough to hide this little swelling. If you're a guy, it's 4 to 6 weeks if you have really short hair. The next question is, can you explain a brow lift? So a brow lift is a very subtle thing. A brow lift is the lateral aspect of the eyebrow lifting this up. Not in the center because you look surprised, it's just sort of bringing this up. So for a woman, the eyebrow should have an arch to it. The highest part of the arch should be over the lateral aspect of the eye, so the arch should be up here, and the eyebrow should be above the bony rim. For a man, the brow should be flat, no arch, and it should be at the bony rim, okay? So as we age, like people come in all the time and like, oh, I have all this eyelid skin. And in reality, as this deflates, as we lose the bone, we lose the fat, the skin loses its elasticity, this starts to sag and drag down like this, okay? And it makes it look like there's a lot more eyelid skin there. So when people have this saggy, you have to sort of lift this up and bring this up so that they look more refreshed. But it's a very subtle thing. It's not to the sky, and like people think of all these movie stars who've had brow lifts and stuff like that, and they look really bizarre. Well, sometimes they're trying to make themselves look like, for men, if they raise it too high and they give themselves an arch and they're above their eyebrow, that feminizes a man. That makes the man look like a woman, and sometimes that's what people want. They want to have a more feminine look. But brow lifts are just subtle things. Oftentimes they're done with upper eyelid procedures. So so you do the brow lift first, and then you'll have less eyelid skin there, and then you just trim out the rest of the eyelid skin. It depends on what the person sees. Some people, it's like, oh, I just see the skin, or oh, I see the brow. What people have to realize is that if they have brow ptosis and they just do the upper eyelid skin, it doesn't lift this up. It doesn't reposition this up. Okay. And so that's sort of sags down. And so the procedures that you have one non-surgical way to make a brow go up, and that's with Botox or Dysport. So there's a muscle that wraps around the eye that's pulling this down. There's the muscle of the forehead that's pulling this up, and those two muscles are in tug of war. And you can inject the depressor muscle with Botox or Dysport, weaken this. Now this muscle's now unopposed, and it can pop your eyebrow up. Doesn't work for everybody. If people are really, really heavy, it doesn't make this muscle stronger. It's only paralyzing this. Okay, so what I tell people is all you have to lose is your money. You put it in, you try it. Your homework is to see if it works. If it works, then it has value, then you do it again. If you do it and it doesn't pop up, then it ain't going to work. And then you realize, well, listen, then I have to do surgery. Surgeries can be done many different ways depending on the person. Sometimes it's done an incision at the hairline. Sometimes it's done in the hairline, endoscopic approach. Sometimes if people have deep wrinkles, it goes into the lines. We're going to try to do, our goal is to do this monthly and to do topics. And so I'll go in more detail, like I'll have a talk on facelifts or a talk on brow lifts going forward. So we're going to try to do this a monthly event. We'll go into, like, and each will go into more detail on those type of procedures. But a brow lift, again, you'd probably want to do that 6 months, 3 months, no sooner than 3 months. You want to do that 6 months in advance of any big event. Downtime with a brow lift is bruising, right? If the incisions are up in the hairline, you'll have a little bit of swelling up here. The incisions hide, so you're never going to see those. For the first couple weeks, this is going to be a little, like first week or two, this is going to be a little too high because it's swollen. And then as the swelling settles down, it's going to fall, right? So it's going to be a little overcorrected for the first week or two. These stitches come out at 10 days. So the downtime is really predicated by the bruising. So sometimes people bruise a little, sometimes people don't bruise at all. But figure about 2 weeks again, depending on your hair and if you can pull your hair down and stuff like that for that big event. The Botox thing, so doing Botox for to get a brow lift, you'd want to do that probably around, again, you don't want to experiment with that right beforehand. You don't want to come in cold and like, all right, I got a wedding in a month, I'm doing this. But you'd probably want to do that at about 6 to 8 weeks before the event. When you do this, it's not like you can put a gallon of stuff in there. So I tell people for here, it lasts about 3 months for doing the brow lift. You have to come back and touch it up about every 3 months. So you'd want to, so for a big event, you'd probably want to do it at 2 months, 8 weeks, 6 weeks before the big event. That would be the sweet spot for trying to do a Botox or Dysport brow lift beforehand. Rhinoplasties. Now, rhinoplasties are a complicated thing. Rhinoplasties, we talk about it taking a year to see the final end product, because it takes time for the skin, for the swelling to settle down, for the skin to shrink wrap to the structures underneath. In reality, a year is an arbitrary time point. It's just an easy time for us. We say a year. But as long as you're living and breathing, when you do a rhinoplasty, that skin, that structure is always healing. It's always contracting. It's always trying to get tighter and tighter and tighter for the rest of your life. But for a rhinoplasty in a big event like that, say you have a little lump, like you do the rhinoplasty, like when I do a rhinoplasty, you come back at a day, a week, a month, 3 months, 6 months, and a year, because I'm watching that skin, I'm watching that heal, I'm watching that contract over that time period. Rhinoplasties have risks, lumps, bumps, asymmetries. Okay, it's every surgery I do, everything I do has a risk. Say you have like a little bump or a little asymmetry that we need to fix. You usually have to wait a year to let everything heal to judge how bad it is or what you got to do. So if you're doing a revision rhinoplasty, if you have to tweak something, you're going to do that a year in advance or a year later. So you don't want to do a rhinoplasty a year before a wedding. You want to do it 2 years before a wedding. You don't want to do it within the year at all, because there's too many variables with that. Way too many variables. So a rhinoplasty, I would say wait till after the big event and do it, or you're going to do it 2 years or more before a big event, because you don't want to get involved with that right before a big event. Otoplasties. So a lot of times we'll change the shape of people's ears. We'll pin their ears back, right? So sometimes they stick out, we'll bring them back. Again, for adults, we do that in the office with just local anesthetic. There's a little incision that's behind, can be a little swollen, bruised a little bit here. So if you're thinking about doing an otoplasty, again, probably you'd do it like 3 months or further, right? So you wouldn't do it less than 3 months before a big event. You'd want to do it 3 months or like 6 months or a year beforehand, but no closer than 3 months before a big event. Just because it takes a little time for the swelling to go down, it takes a little time for the bruising that like sometimes people get a little bruising there, but that like within a month, that within a couple weeks that's gone if there is any bruising. But the swelling on the backside takes a little time for that to resolve. The thing that I forgot to talk about, I'm gonna digress for a little bit. Acne scarring. So we see a lot of people who have acne scarring and they're getting married or they have a big event and they want us to fix their acne scarring. And I'm talking about depressions, like not really ice pick acne scarring, but the sort of the depressions that are out in the cheeks that gives you those shadows and stuff like that. Those are the way I treat that is not laser. I treat that with injections with filler. I inject each individual one with special magnifying glasses to lift them up and to spackle them out. But you're going to want to do that 6 months to a year in advance. So if you have acne scarring, what happens is how I do that is we have you put topical numbing medication on, and then we lay it back, and it's like a shadowy room, and I do each individual right in the skin with a little bit of filler in each individual spot. 10 minutes later after I do that, it's going to become a welt, and it's probably going to look a little red from just the irritation of it. Again, just like the fine lines of the upper white lip, it's going to be welty for about 5 days. It's going to take some time. Could be red for a couple weeks. Could be red for longer, depending on the person's skin. People will always say, after I do this acne scarring injections, they'll say, it looks better at 3 months than it did at a month, right? Because it's maturing. The redness is settling down. Everything's settling down. The skin is starting to heal. It's all starting to mature. So if you have acne scarring and you're going to do filler, you want to do that way, way in advance, because you want to let time go by to let all of that healing, let that maturation of that is for it to improve. The thing with acne scarring is that when you put makeup on contours like acne scarring or wrinkles for that matter, makeup and contours do not play well together at all. Makeup always makes contours look worse. Always, be it a wrinkle or a scar. So when we fill these though, and say for a woman it's easier, men it's harder because women are used to wearing makeup and covering things up. But we do, so I do the acne scarring. It might be red for a couple weeks, but they can put makeup on the next day, and now that contour is gone, and now the makeup is covering up that redness. So for women, when the welts, or for men that wear makeup, you can actually get out like in a week or two, pretty quick. But in both situations, you'd want to, if for a big event, you'd want to do that 6 months in advance or further out, because you want to have enough time for that everything to settle down, for everything to mature, and it always looks better as time goes by. Are there any other topics that you guys, any questions in regards to big events that I haven't addressed that someone has a question about? Are there any questions that anyone has? I don't even know what time it is. It's 8:11, so I've done an hour. So it's now 8:11. We're gonna try and do, if there's no questions, we're gonna try to do a Facebook, if people like it and it's educational. We're gonna try to do one monthly on the second Thursday of the month. So every second Thursday, we're gonna do an hour at 7 o'clock. We'll do different topics. If people have any topics that they want me to discuss specifically, just email us or text us or message us and let us know, and I can do an hour talk on whatever topic that you want to talk about. All right. So thank you all very much, and I hope you have a good night. And again, if you have any questions, just email us at info@stanislawmd.com. Okay. Have a good night.